What if we could no longer treat simple pneumonia, or if every surgical procedure carried an immense risk of deadly infection? Unfortunately, this scenario could become a reality if we fail to stop the growing threat of antibiotic resistance. Welcome to a world where the clock on effective antibiotic treatments is slowly ticking away. Antibiotics are among the greatest discoveries in the history of medicine. When Alexander Fleming observed the effects of penicillin in 1928, he revolutionized how infectious diseases were treated. During World War II, the mass production of penicillin drastically reduced deaths from bacterial infections. Unfortunately, over time, it became clear that the more we use these miracle drugs, the faster bacteria learn to resist them. While antibiotics is a term we use daily, it's worth revisiting how they actually work. In simple terms, antibiotics target key life processes in bacteria, for example, cell wall synthesis, protein production, or nucleic acid replication, leading to the pathogen's death or halted growth. Various classes of antibiotics, such as penicillins, tetracyclines, macrolides, work through different mechanisms, enabling us to tailor treatments to specific infections. However, bacteria are incredibly adaptable organisms. Through mutations or genetic exchanges, like plasmids, they quickly develop defenses, altering their cell walls or producing enzymes to break down antibiotics. The more we use these drugs, the greater the selective pressure for resistance to emerge. Today, we face a very real danger: bacterial resistance to previously effective drugs. According to the World Health Organization, if we don't take decisive action, superbugs could cause up to 10 million deaths annually by 2050. These bacteria are exceptionally clever. Through mutations and gene exchanges, they survive contact with antibiotics that would have once been fatal to them. The widespread and sometimes careless use of antibiotics accelerates this process. Our most powerful tools for combating bacterial infections may soon become ineffective against increasingly resistant pathogens. One might think the solution lies in simply developing new antibiotics. However, research and development for antibacterial drugs are incredibly costly and time-consuming. Bringing a new antibiotic to market can cost hundreds of millions of dollars and take over a decade. Pharmaceutical companies often prioritize chronic illness treatments, like those for lifestyle diseases, which yield higher profits. Antibiotics, by design, are typically used for short periods, making them less financially attractive. As a result, there are fewer new antibiotics entering the market, while bacteria continue to evolve and demand ever more advanced solutions. On the so-called superbugs list, bacteria recognized as particularly dangerous are several pathogens that pose a serious threat to modern medicine. Methicillin-resistant Staphylococcus aureus is resistant to methicillin and many other antibiotics, making it a major hazard in hospital settings. Klebsiella pneumoniae is another concerning pathogen, known for causing severe cases of pneumonia and sepsis, often encountered in healthcare environments. Pseudomonas aeruginosa has become increasingly resistant to last resort antibiotics, leading to severe and sometimes fatal respiratory infections. Enterobacteriaceae, including certain strains of Salmonella, have developed resistance to carbapenems, some of the most potent antibiotics available. Each of these microorganisms has the potential to turn relatively simple infections into significant medical challenges, complicating surgeries and increasing the risks associated with medical procedures. Why are antibiotics so overused? In some countries, they're available over the counter, leading many to take them for every infection, even viral ones. The problem also exists in agriculture. Farmers often use antibiotics prophylactically to increase yield and prevent diseases in large-scale animal farming. The result? Bacteria are repeatedly exposed to antibiotics, giving them more opportunities to learn how to neutralize them. This creates a vicious cycle. As resistance spreads, we turn to stronger drugs, further exacerbating the problem. Are we doomed to return to the pre-penicillin era? Not if we take collective action. Responsible use of antibiotics is essential, ensuring they are prescribed only for bacterial infections and always taken according to medical advice. At the same time, improving hygiene and preventive measures, such as vaccinations, hand washing, and safe food practices, can significantly reduce infections and the need for antibiotics. In agriculture, stricter regulation is crucial to limit the prophylactic use of antibiotics in livestock, which often accelerates the spread of resistance. Finally, supporting research is vital to the fight against antibiotic resistance. By investing in the development of new drugs and exploring alternative therapies, such as bacteriophage treatments, we can ensure that humanity remains a step ahead in this critical battle. Antibiotics remain one of our most powerful tools, but we must use them wisely. If we allow resistance to continue growing unchecked, we risk losing not just the ability to treat common infections, but also the safety of surgeries and cancer treatments. This is our wake-up call to act. Remember, simple choices and conscious decisions by each of us can help preserve the power of antibiotics for future generations. Together, we can ensure this invaluable resource doesn't become a relic of the past. What do you think the future of antibiotics will look like in the world? Share your thoughts, subscribe to the channel, and let's stay connected.